state agrees on what should be the bare minimum of a 12th grader graduating with science knowledge. 6 states, so the light gray, have completely independent science standards. They do their own thing. 24 states use their standards based on only the framework. And 20 states, plus DC, have truly adopted next generation science standards. Anybody here from West Virginia, Tennessee, or Oklahoma? Nobody? Okay. Those 3 states in the next 2 to 3 years are going to transition to having adopt the next generation science standards. And you can see that there's a difference in the percentages. It's because not every state has the same population. Okay, I know this is busy, but it serves a purpose. It illustrates that you can easily apply One Health into the next generation science standards. If you live in a state that's in the dark blue, those that have adopted next generation science standards, and look, including Washington, D.C., then when you develop lesson plans, you need to make sure that at the top of the lesson plan it says, this lesson fits the needs for, and then you list the topic, okay? The far right is before 2013, what kids of different age groups were taught. The new next generation science standards refer to 2013 and on. So I've highlighted for you where I feel One Health can easily fit if you just use some creativity. For instance, how parents help offspring survive. You can talk about how a tree develops a pine cone, and then those seeds get released and dispersed inside the pine cone at a certain moisture or heat or temperature, anything like that. And then in relation to that, you can talk about how humans, so parents, can support their child X amount of years until the child is fully functioning. And then you can talk about how, say, elephants have to, when they see a lion around, they have to keep the young, the calf, right in the middle of all the big elephants, right? So protection. So you can have these kids, even though they're really young, grade 1 is 6 to 7 year olds, you can have them understand, oh, my mom or dad or grandma is taking care of me, but if I was an elephant or like a seed, then, you know, next generation, right? So opens up their eyes to new things. Grade 2, diversity of life in different habitats. One Health would work well there. Now I worked mainly with 3rd graders with with Bay Area Scientists in Schools with UC Berkeley because there's one thing in here that's screaming out at me, One Health. Can anybody guess? I'm hearing something. The independent relationships and ecosystems. Interdependent relationships, I mean, that equals teamwork, that equals One Health. That's like a gift. Use that. And certainly the 3 others that are in the box. Grade 4, impact on earth processes on humans and animals and plants. You can easily create a lesson based on that. Last but not least, grade 5, decomposers and ecosystems. You can talk about how a compost heap works and how insects are needed, like worms are needed in the function of compost, and then what type of food can benefit from a compost, right? And then how can people stay healthy with those types of things? Okay, has anybody seen this before? Yeah? Where's this coming from? Pardon me?
Public health class.
Yeah, public health class, I'm sure of it. Good job, public health teachers. Okay, this is the next generation, this is the United Nations Sustainable Development Goals. I wanted to put UN there, but it just looks like unsustainable. So you don't want to write that on a slide. United Nations Sustainable Development Goals. Just like before, I've highlighted where One Health works very well. I mean, look at number 17, partnership for the goals. Partnership equals teamwork equals One Health. Now, for number 7 and 13, affordable and clean energy and climate action. Guess what? Climate action, climate change, that's all in the news. That's what a lot of people are talking about right now. Just last month, this Teachers and students push for climate change education in California. And guess what just happened? The educational system in Italy now has made it mandatory for all students to learn about climate change. Interesting. Get on these topics. One Health can easily slide into climate change curriculum. It teaches empathy and teamwork, of course, and a lot of technologies now can be used to improve the health of the environment, animal health, and human health. Can you think of any? Don't tell me, just make a lesson about them. Okay, so there are readily available lesson plans out there, and certainly I don't know of every lesson plan that's out there on this planet, but that's what the One Health Commission is for. It collects as much information around the world as possible. Bay Area Scientists in Schools has fantastic templates that you can just modulate for your needs. The CDC, Center for Disease Control and Prevention, has a fun lesson that teaches kids about salmonella, so bacteria, and how you can get salmonella from your pet hedgehogs. Anybody heard this before? Yeah, okay, good. So a few. Bay Area Lyme Foundation has a tick-borne disease type of lesson. University of Colorado at Boulder. Now this is something that you guys at GW can definitely benefit from. So please pay attention here. There's something called a research practice partnership. And what the faculty and students at University of Colorado Boulder did is that they created a biology curriculum, so lasting several weeks for students, and one of the classes in those weeks is devoted to antibiotic resistance. Why don't antibiotics work like they used to? And from there, they pitched the idea to Denver Public Schools, and it was fully accepted. So just because you are in one university, you're also in a community. So just like Bay Area Scientists in Schools that has community outreach programs there, if GW doesn't have something like that with STEM programs, make sure it does by the time you finish here, because it's all about sustainability, right? Now, you might know about this, but antibiotic resistance is a huge thing, antimicrobial resistance. And more than, by the year 2050, the expectation is more people are going to die from antibiotic and antimicrobial resistance than in 2050 than they are dying from cancer today. So let me say that again to have that sink in. By 2050, the expectation is that more people around the world are going to die from antimicrobial resistance than cancer today. It's a big thing. So are we going to develop new antibiotics? Yeah, sure, we're trying to. Are we going to try to develop more vaccines? Yeah, sure, we're trying to. But can we improve the prevention? Can we teach kids to maybe wash their hands properly, not pick their nose, right? eBug out of Public Health England has made so many fantastic educational materials, not just for the community, but for kids. It teaches kids how to properly make a sandwich, how to organize the refrigerator so that raw meat juice doesn't drip down into your salad underneath. They go well above and beyond any expectations, and it's a lot of fun. So get on that website, bookmark it, share it with as many people as you know. Rice University has a very good detective type video game online that's free to access. New York Hall of Science, now this deserves a shout out. This is incredible. I spent an hour and I was smiling the whole time playing this game. It's an interactive comic. And what it does is it is loosely based on a 1999 epidemic that had several people in New York City dying and crows dropping from the sky. Has anybody heard about this in your class? Yeah? Yes, no, maybe so? Yeah, do you remember what virus was detected with that? It was a brand new virus at that time in North America, and it was detected by a veterinarian, Dr. Tracy McNamara. It was the West Nile virus, and it was not known to be in North America at that time. Next generation science storylines. There are science classes that definitely need to be improved upon, and you can incorporate One Health in that way. More resources, certainly Dr. Lucey will shortly talk about the outbreak exhibit, and you can have a do-it-yourself version, just like what's behind me. And if there's nothing else, this is what you need to really remember. There's something called One Hope. One Hope stands for the International One Health for One Planet Education Initiative. So if you want to go out and create lessons and bring them into your community, but you don't want to do it alone, I had to do it alone because what I've done, nobody was doing. So I had nobody else to work with. But if you want a network and you want your lessons to go global, get on the One Health Commission website, type in One Hope, and sign yourself up on that list. The first meeting is going to start in the next few weeks. If you want to work domestically, so in the United States only, the One Health Education US team is also working on a similar project. You can, of course, get my email, contact me, and I'm happy to have you use some of my lessons about these various diseases and topics in your community. I want to know exactly who's using my lessons because I modify the lessons to meet the cultural needs of the students and the technical needs of the teachers. When is the best time to approach the teacher? When it's a solid idea, when it is written in a style that they truly understand. Remember, Bay Area scientists and schools have templates, so you can easily go to that website. And make sure it meets the local standards. The best time to talk to teachers, September and January. Why is that? Start of the term, right? Is before the teachers get flooded and too anxious with the rest of their material in school. Okay, now I live in DC right now. I just came from California. I needed to make sure that my lessons are still going to be taught in California. How do I do that? Well, I need to make sure that I get feedback from teachers, and I want to make sure that the lessons are as good as they possibly can. They could be standalone, and keep what works, modify the rest based on the feedback, and train the trainer. So you see this arrow? That arrow is Doris Ma. She's a pre-veterinary student, so she's an undergraduate student at UC Berkeley, and she's recruited 2 other pre-veterinary club members at UC Berkeley to go out and teach. This is a 3rd grade classroom, so continue with my 3rd grade lesson. Just this week, she emailed me and she said that on Tuesday was her last lesson, so that was the 6th of the semester alone. I'm going to leave you with a story. It's a lessons lesson. One day, at the end of a lesson, a little girl was eagerly raising her hand, okay? She was like this. Actually, she was like this, okay? She was pretty much out of her seat, across the desk, and her fingers were spread so wide it looked like they were going to dislocate from her knuckles. I was very impressed. She had a question to ask. She asked, "Are you going to teach kids around the world about One Health?" And what do you think my answer was? Yes! Yes! But I need your help. And that still stands true today. For all those listening here in the room, I ask one thing of you. I need your help to bring One Health into your community. Because after all, at the center of One Health is teamwork. Thank you.
Okay, thank you, Dr. Thomson. That was awesome. Flip my notes upside down. I can't read upside down. Next, we have Dr. Daniel Lucey, who wears many, many hats, but he's here to talk mostly about, he's the originator of the One Health exhibit at the Smithsonian. But also, he is an infectious disease and public health physician who has been advocating for One Health since 2007. He served on the One Health Commission from 2015 to 2019 and represented Georgetown University on the Global Health Security Agenda from 2014 to 2017. He's worked in Asia and Africa since 2003 on a dozen epidemics, including SARS, MERS, avian pandemic flu, Nipah, Zika, and plague. And he also traveled to Liberia with Doctors Without Borders in 2014 to work on the Ebola outbreak. As I mentioned, he's the originator of the Smithsonian exhibition Outbreak Epidemics in a Connected World, which opened in May of 2018 and is closing November of 2021, so we still have some time, but not enough. He proposed One Health as the unifying theme of the exhibit, and there's a number of different examples that if you go, you can see how One Health fits into a variety of different diseases. He trained at University of California, San Francisco, and starting in 1982, which is during the height of the HIV epidemic, though at that time we hadn't yet discovered that it was HIV was the virus that was causing AIDS. He was a fellow at Harvard and an attending physician at the NIH Clinical Center. He was the chief of ID at Washington Hospital Center from 98 to 2002. And he's a adjunct professor at Georgetown University Law Center. He is teaching a class on One Health at the law school in the spring, which is pretty cool. So if any of you guys I think you're all GW people, but if you're interested in One Health and law, maybe, yeah.
More than consortium, right?
Consortium, exactly.
Also legal.
Please welcome Dr. Daniels.
With Michael's very thorough introduction, now my talk can go from 60 minutes to 20 minutes. That includes questions and lunch. So, can you hear me okay without the mic?
Yeah.
So, okay. I'm afraid I'll drop it or something like President Obama.
Is that the right one?
That's the right one. I know. I'm looking at it like, what? Whose slides are those? So those are my slides. Let's see if this works. Yes. So two of my favorite sayings are, one, people ask me, students mostly, well, what's next? I always talk about all these epidemics that Mike mentioned that I've gone to over the years. I won't say how many years, but 1982 and maybe a little bit before that. So what's next? I always say what's next is already here. But we just haven't recognized it yet. So it means to be very alert to what's out there or what's here. In the case of HIV in San Francisco in 82, I say it came to us, to where we were. In the case of anthrax in 2001 in DC, it came to us where we were. So it's not just things on other continents, across oceans, it can be things right here, where you are now. And for me, there's one lesson that encompasses all the others, or at least it's the most important lesson in my view. People say, well, what about lessons learned? And you've been going to other countries since 1979 as a medical student. And what lessons have you learned? And I do have a list of like 35 lessons, but who's going to listen to 35? Who's going to listen to 30? Who's going to listen to 10? Okay, 5 maybe? I don't know. So I just took it down to one. It's 3 words, 3 verbs. Anticipate, recognize, and act. Anticipate, recognize, and act. And for me, that sums up what's most important about everything in clinical medicine, taking care of patients, hospitals or clinics, or in terms of epidemics, known and unknown, present, past, and future. So anticipate, recognize, and act. So it's a great honor to be here. I really appreciate it. Thank you to Michael and to Gary for organizing this, to Dr. Bernard Denham, who's been a good friend, One Health colleague, at least since around 2013. I think he came over to Georgetown when I tried to start a One Health program there, but it didn't work. It didn't work. So I, part of that reason, but mostly for other reasons, went to the Smithsonian Museum of Natural History, so dinosaurs and diamonds is what I call it. Don't tell them I said that. It's so much bigger than that. But the Hope Diamond is there. And they just opened the new fossil hall, the dinosaur hall, after several years of refurbishing it, if you will. And so there's many wonderful things to see there. on the second floor, just down the hall from here to the door, or if the door is the Hope Diamond, where I'm standing is the beginning of the Outbreak exhibit. So it's open 7 days a week from 10 a.m. to 5 p.m. Please have a visit if you haven't already. And if you ever wanted a guided tour with someone who talks too much about the academic, I'm glad to do that. And I do that all the time for small groups, individuals, or large groups. Most of the, nearly all of the epidemics in the exhibit are ones that I've gone to, and participated in, and one of the best things about the exhibit, in my view, is that it was able to involve many people who I've worked with in other countries and in this country, who give very short, less than 100-word personal perspectives. So there's a picture of them, and then 99 or fewer words, and there are about 42 of those in the exhibit. About 30 of whom are friends that I've worked with in various places around the country and around the world. So the only person who couldn't give less than 100-word personal perspective, which I thought none of my friends would be able to do that. 30 people. When the museum said, "Well, do you have any friends who maybe could give a personal perspective?" I said, "Oh yeah, lots of them." And he said, "Well, how about a picture and less than 100 words?" I said, "Well, no, 100 words? Are you kidding? That's a little bit of an insult. I mean, they spend decades of their lives in a career. Less than 100 words." They go, "Okay, well, those are the terms of engagement, so either it's that or nothing." I said, "Okay, well, I'll ask them, but I can't guarantee anything." All 30 of them said, "Yes, sure, great, thanks." But there was one person who said, "No, can't do it." That was me. And sure enough, true to their word, they said, "Fine then, you don't get one." I thought they would like back off, or like make some special dispensation because I proposed the exhibit and worked on it for 3 years and whatever, but no. But they did have a nice thing at the very end, which they didn't tell me about, which there's a plaque on the wall that says basically, "What's next?" And then they have this phrase, "What's next is already here, you just haven't recognized it yet." And I first saw it, I said, "Hey, that's my thing." And then they have my name at the bottom, so I'm very, very thankful for that. So I'd like to emphasize one thing from the beginning, and then I'll talk a little bit about the exhibit. So One Health is catching on, and has been for many years, but slowly, especially in my community, the human health community, if you will, especially in infectious disease doctors for some reason, not to mention cardiologists or other doctors, but physicians. But it's really catching on. And in 2016, there was a bill put forth in the Senate. It didn't get out of committee, it didn't become law, but this past summer, June and July of 2019, both in the Senate and the House, there was an identical bill, which is called this, Advancing Emergency Preparedness Through One Health Act 2019. So hopefully it's going to advance and someday become law. It might take, now I'm talking out of school here since I don't know so much about how bills become laws, but what I understand is that they can do so sort of on their own through going through committees and being voted on, et cetera, or they might be attached to a larger piece of legislation that gets approved. So I'm hoping that that might be a more that might happen, the latter, more realistically. So if it does, then it's really going to change the visibility and the operational significance of One Health. So this is a proposal to have a cross-government, sort of across agencies of government and multiple departments, so Department of Health, Department of Agriculture, NIH, Food and Drug Administration, Environmental Protection Agency, Department of Commerce, Interior, help me out, Bernard, I'm forgetting others.
You advanced your gun law.
USDA,
Homeland Security.
Homeland Security, right. So, and of course you're here in Washington, D.C., and it's 2019, and so anything that has the word security on it is more likely to be given attention and funding. That's my opinion. We're not being recorded. Definitely not taking, I hope. I don't see any CCTV in here. Okay, so I just want to call your attention to this. This is a really important piece of potential legislation, potential law. It will really change the recognition and acceptance of One Health if it eventually becomes law. Okay, I'm going to go through this. This is my life in the last 40 years of career. So I'm just emphasizing the One Health. You can see I underlined One Health. All these different outbreaks that I've gone to. Been very fortunate to go in many different countries, in South America, to Asia, Africa, and elsewhere. For epidemics that are, I call One Health epidemics. In other words, they are pathogens, mostly viruses, but some bacteria like plague in Madagascar in 2017, Yersinia pestis bacteria, that come from animals into our species and then tend to spread from person to person to person. Sometimes there's repeated jumping of species. I'm not going to jump because I can't really jump too well like Dr. Thomson did, but basically jump species repeatedly. For example, the Middle East Respiratory Syndrome, or MERS. Who knows what animal that jumps from to us? Camels, and does so repeatedly. But also it's spread from person to person. But others like Ebola jump, and HIV jumped, but then basically after that it's person to person to person spread. Obviously with Ebola there's multiple jumps that have occurred since we first identified it in 1976, which is different than when it was first in our species. We just hadn't recognized it, I think, prior to 76. But there's been, I don't know, 28 outbreaks of Ebola, including 10 in the Democratic Republic of Congo since 76, formerly Zaire, including the one now, which is in the eastern Congo, the second largest one of all time after the tragic one in West Africa, 2013 to 16. So partly from going on all these epidemics, partly from teaching about epidemics, and partly from feeling very old and just a little bit scared about Ebola just before I got on the plane, August 7th or 6th, 2014, to go to Sierra Leone to work with patients, and then to Liberia with Dr. Top Borders or Médecins Sans Frontières, MSF. I went to the Museum of Natural History to talk with them, propose this exhibit. I couldn't have done it without a student. So there's a graduate student at Georgetown who I'd been working with, who she'd come up to me and said, you have a very strange reputation, you cause a lot of trouble, people don't really like you, but, I mean the faculty, but you're so strange. Like One Health, and go to epidemics, and it's very weird, you're very weird, so I'd like to do an elective with you. Hey, that's a strange introduction, but she says, I want to study Nipah virus in Bangladesh. I said, it's one of my favorite viruses. Of course, there are like 50 favorite viruses, but I didn't tell her that. I said, oh yeah, that's great, that's one of my favorite ones. So anyway, now she works for Centers for Disease Control in Atlanta, in their Emergency Operations Center, and so, but she knew someone in the Museum of Natural History, an administrative person, who was in charge of new exhibits. But normally they don't just take somebody walking in off the street, so to speak, like I was, to propose a new exhibit. They have internal experts and smart people and connected people, et cetera, et cetera. But anyway, eventually they said, well, okay, we'll give it a go, but you have to raise $3 million. It's like, well, I can barely pay my apartment rent in DC. They said, that's okay, we'll give you 2 people that work for the museum and they know how to raise funds. And you just get on the phone call, and first of all, you tell us names and phone numbers of your friends who might have money working for philanthropic organizations. And then we talk with them, and you get to talk, but no more than 2 minutes and 59 seconds, because you tend to talk too much. So I was like, okay, let's be candid now. So they said, you give them the sales pitch about different viruses or whatever you call those things. You keep saying pathogens, whatever pathogens are, and then be quiet. And we'll talk to them nicely about how it's in their best interest to support the exhibit financially. So we did this for 12 months. Guess how much money we earned? Yeah, nada, zero. So I didn't say a thing about who's the expert now. No. Or maybe I can have like 3 minutes and 1 second. No, I didn't say that. No, I was thinking it, but it would have been counterproductive to say it. So, but still, I sometimes say things. That's like a student said. Bad reputation, say things I shouldn't say. Bite my time. And so after 12 months, they said, okay, if we don't have, I don't know, let's say $500,000 by the end of this month, then it's over, finished. And that was a big dose of reality for me, because now I totally sold into this idea, like this is gonna justify my life to my kids, and like to myself, like what have I been doing all these years, doing all these epidemics, and the problem was nobody wanted to be first. We talked to all these well-known organizations in California, Seattle, New York City, Texas, Chicago, everywhere. London, would be in the UK, London, and nobody wanted to be first. And I thought that everybody would want to be first, because like in science or publications or medicine, it's like discovery, you gotta be first, gotta get published. No, it's very different in this world, the philanthropic world. Nobody wants to be first. Why? Because they don't want to waste their money, because they feel like dinosaurs and diamonds, why would the Museum of Natural History want to do an exhibit on epidemics? So nobody wanted to be first. So I called a friend in the great state of California, where I was born, I didn't grow up, and where I did training in San Francisco in 83, 85. And I said, this is it. And somebody I worked with in the field. And when you work with somebody in the field, you make strong bonds, strong friendships. And I'd already talked with him multiple times. He talked to his board, and the board just said, yeah, too risky, we're not giving any money. So I said, look, it's gonna be done. It's done before it even started. So he says, I'll talk to him one more time. So he did, and then he said, okay, we'll give some money, but not nearly the amount that was required by the end of that month, August of 2015. But that was it. That was the key that opened the door. So now